Okay, as General Weber pointed out in the last session, our two primary tools for combating impaired driving are enforcement and education. We spent a lot of time and got some great information in terms of some enforcement ideas and methodologies and a lot of things that we can do when we go back to our communities. Now we're going to take a look at how education and community participation can be used to reduce the number of local alcohol-related crashes. Throughout the day, we've been talking about partnerships and collaboration and how collaboration leads to fresh solutions and lasting change, and that a key to success is keeping people informed and involved. And our next presenters are experts in directing people towards healthy and safe actions. They've built organizations and developed community programs that are countering impaired driving, and they're making a real difference in improving the communities in which we all live and work. Our first speaker is Nicole Holt. She is the Executive Director of Texans Standing Tall. They're one of our many sub-grantees that we're proud to partner with. It's an organization that works to address youth substance abuse prevention by organizing adults, youth, coalitions, agencies, and others to implement change. She has spent her career creating healthier and safer communities and making alcohol, tobacco, and other drugs irrelevant in the lives of youth. She has deep experience in how to engage the community as a means to combat impaired driving. I'd like to have Nicole come on up. Thanks for being here today.
So I'm going to talk to you about community solutions, in particular to reduce underage drinking, because that's our primary focus as an organization. But I want to talk to you about it in terms of doing coalition work and evidence-based prevention strategies. And so the mission of Texans Standing Tall is to create healthier and safer communities, and our vision is to make alcohol, tobacco, and other drugs irrelevant in the lives of youth. And we intentionally use the word irrelevant because we believe alcohol, tobacco, other drugs should be as important to young people as mortgages and taxes. And if you know of any young person who's concerned about mortgages and taxes, well, they're really someone I have not yet met. So. I do want to point out, I have a note to myself that because we're going to talk about civic engagement in this context, that in addition to Chief's mention of defense attorneys funding election campaigns, I took the slide out of here that indicated how much the alcohol industry actually contributes to people's election campaigns. And so make no mistake that the alcohol industry is a huge contributor to people getting elected and decisions that are made at the Capitol. And that's important when we're talking about things like sobriety checkpoints or keg registration or other legislative options that we might have for prevention of impaired driving. So Texans Standing Tall focuses on prevention from a community change perspective. We focus on using evidence-based strategies and enforcement. We're very passionate about civic engagement. We focus on a very comprehensive approach to prevention, that there is no silver bullet and that we all have to kind of use all of our skill sets as well as a multidimensional strategy in order to be successful. And a high visibility enforcement campaign would be an example of that. My background is that I'm a trained community organizer, and I share this with you and the statement about that I was invited to speak at 2 international public policy, alcohol policy conferences sponsored by the World Health Organization, because I was specifically asked to talk about civic engagement and what that means. And so it is not just a call to action for us here to be civically engaged in our prevention strategies. It's a World Health Organization call to action internationally that we be civically engaged and have community prevention practices that we all employ. And a lot of times we don't know what that means. And so that's part of our challenge. What does it mean to be collaborative, and what does it mean? I mean, like, we know what it means in the sense of, yeah, I'll work with you and you'll work with me, but we don't necessarily know how to do it. And so what we find is that often what you're dealing with is converting passion to effective action. And there's a challenge in there, because a lot of times as prevention professionals, and that includes all of us in this room because we're talking about preventing impaired driving, that we talk about being really passionate about our work, but we're not trained in community organizing. We have no idea how to do it. We don't know how to do civic engagement, really. So when we were talking about, and you've heard several people talk about this today, you need to get engaged, and you need to get a part of the process, and you need to be talking about policy change, and you need to be invested in this, you need to be invested in that. If you don't know how to do it, or worse yet, that you've been told you can't, that makes it really hard for us to move forward on a lot of these objectives, because not everybody has the freedom, unfortunately, that the chief has to go up there and pound it. And we're excited that he can go up there and pound it. But the rest of us have to beat our drum in a slightly different way, perhaps, but it has to be tapped on and make that loud effect. Because you all have heard the rain thing before, right? Everybody does this, and then everybody does this, and then everybody pounds, and suddenly it sounds like rain. Well, that's what we have to do as part of our civic engagement, a part of our pieces, not the lobbying piece, but a part of that civic engagement piece in order for us to be successful in our collaborative work. And so it's hard to strategically plan if people haven't told you how to do it. They just told you what to do and not how to. And it's hard to do a lot of the strategies that we're told to do when we don't have a lot of information around how that process works. And so we have a gap. We talk a lot about the problem. We even talk a lot about potential solutions, but how we fill that gap in order to actualize the solutions is a challenge for us often. Do I have any agreement on that? Some of y'all look at me a little nervous right now. Like, I happen to believe quite strongly in this because I spent a long time being trained as a community organizer, and some of that stuff is easy to do and comes natural, and some of it's really specific skill sets that take us some time to learn. And so let's talk a bit about how we begin to create some of that change. So if you can shift the burden from it being your problem to a community problem with a community solution, which is a lot of what we've been talking about today, but it's not just about me and you, but about us together, and it's not just about you all, but when you go home, the rest of everyone. How do we begin to build the lasting long-term relationships that it takes in order for us to do this work? And that's what Texans Standing Tall spends a lot of time doing. The Department of State Health Services is funding almost 43 community coalitions that are in your communities, most likely, that several of you all, if not many of you all, are working in. And they too care about no refusal weekends, and they too care about underage drinking. In fact, it's one of their priority objectives. So if you're out there starting a coalition and one already exists, we've got to figure out how to leverage those resources together, because that's part of their priority. If you have a drug-free communities grant in your community, and there are about 13 to 19 of them, depending on how many get funded every year in Texas, from the national level, those are people who are also working on prevention issues, and we've got to figure out how we collaborate together in a way that makes our work effective and not duplicating. Does that make, how many of y'all go to too many meetings, right? And you talk about stuff, you talk about stuff, and you talk about stuff, but you know what the deliverables are? So building capacity around our passion, tapping into capacity, so a community can respond, teaching skills around advocating for change, all these things that are on the list, these things are how we begin to mind the gap. So having a long-term strategy is how Texas Standing Tall does its work. We focus on identifying the problem, it's data-driven and it's societal, and then we have a plan, we identify capacity. Not everybody, on the day you walk in, some of you all were mentioning it in the last conversation that we had, if the nurses and the hospitals are unwilling to let you use their nurses to do blood draws, and they put up some roadblocks, then you have to either figure out how to navigate that political arena in order to get them on board, and many of us have not been taught how to manage the political arena, or we're not very skilled at it. And part of our coalition work is the knowing when to send the right messenger and which messenger should stay at home. Right? There's a reason the kid goes to grandma or to the right parent, right? For the right thing. Because they know how to send the right messenger or to the right person to get the right response. And that's part of what we also have to learn how to do and how to leverage the resources within the community coalitions that we build. And so we identify capacity, we create readiness, and we also build it. And we do that a lot through forum. We hold an annual statewide summit. We bring in a lot of national speakers, but we have a breakout time where everybody kind of collaborates and picks a strategy and practice skill sets. We do regional forums around the state for the same reason. We have a variety of strategies that I'm going to talk to you about in just a second. But all of that is about how we act and build and move a strategy forward because it doesn't happen overnight. Our passion has to be trained into action. Does that make sense? I know, because I don't want y'all living here today like, I'm so excited. And then like, now what do I do when I get home? Because that's frustrating. I mean, I do that myself when I get really excited and I come home and then I'm like, now what am I going to do with this information? So the question is, what are the actionable steps that you can do when you get home? And you should leave with a couple. So let me tell you a little bit about opportunities for change, and you can start jotting stuff down for yourself. So opportunities are found between what people know about the problem and what people are willing to do about the problem. And that's where you begin to close the gap. And by virtue of the fact that you all sat through this day-long training, even if you had never been to any such training before, you will know more than the average person knows about impaired driving when you go home. You are now the resident expert. You will go home and start explaining stuff. Have you had this happen? It's like information vomit. You've heard people do this. And I mean, you were down here, and now you might be here. And it took a few steps to get there. And you're talking to people like they're on the same level. And they haven't engaged because they don't understand what you're talking about. So part of the way that we build on that community readiness is meeting people where they are and moving them along. Not just meeting them where they are and staying there and hanging out, but having a strategy and next steps for moving them along. The other piece in that is making sure you don't demand more of them than they're ready for, because they'll get angry at you and not come back or not invite you back in. Have you seen that happen before? I'm going to tell you what to do and how to do it and how it ought to be done and how you're doing it wrong and why you should be on my page. And you don't have the authority perhaps that the chief has, and then you can't get back in, right? I would like to have the authority that the chief has. I live in Austin. I work in Austin. I have been known to do that myself. So, beginning to close the gap. So part of what we do and how we do our work, so that's kind of what we do. We do all that civic engagement, build collaboration, and so forth. How we do our work is through environmental prevention. So we look at shifting the context from only focusing on the individual, don't do it, you shouldn't do it. So thinking about drinking and driving, I don't go and try to tell every one of you, don't drive drunk, don't drive drunk, don't drive drunk, don't drive drunk, don't drive drunk. I work on a whole community piece that says, drink, drive, go to jail. And I put it on the news, and I do all the things that the chief was talking about with no refusal weekends, because that shifts the context. So now all of us believe that we might get caught, and we saw some people in the news getting caught, and now I have a deterrent for getting caught, right? So now I don't want to do it. So we change the environment in which the individual lives, acts, and responds. And so the challenge with this work is that a lot of us want to hang out, and most of us do, in here. Not that this is bad work. Don't get me wrong. It's important work. But when we hang out in here, we're doing the thing that has, because it has the least political will and it has the smallest impact, takes a lot of effort and a lot of resources, and we spend a lot of time doing it. But we get very little results. And the largest impact, this stuff that we were talking about, no refusals, high visibility enforcement campaigns, those things are integrated and require much political will, but also have a large impact, but they don't happen quickly. And in Texas, I'm going to argue that it's hard for them to happen at all, because we rank 50, actually I take that back, 51st in the country in voter turnout. How can we be 51st in the country? Because we're even below Washington, D.C. 51st in the country in voter turnout. Today's election day. I hope you heeded all the advice that was sent to you and voted early. It is your only participation at a level field. All of us in this room today could decide the city council elections in Austin if we all went out and voted. Probably that many of us could make a decision about the city council in Austin if we turned out and voted. Not only that, 34% of our nation's folks don't even know the 3 branches of government. They can't name them. So that's what we're contending with when we're talking about if we want to enforce a problem, like conduct enforcement, we have to understand how the judicial branch of government actually works. There's nothing lobbying about that, right? So we have a problem in our country and in our state in understanding how the system works so that we can actually participate in it. And that's really important because you got to find your place and be really a well-oiled machine in order to make the changes that we're talking about. Okay? But there is hope. So this is environment versus individual. And a lot of things I'm talking about, quite frankly, we have a long presentation about how environmental prevention works, a long presentation about community coalitions and so forth. So that would be more in depth. So I'm hitting the highlights for you all now. And feel free to ask us for, I got staff over here, wave your hands. And I have coalition members here, several of you in the room, raise your hands. So they can help you with some of these resources too. Okay? So how do we select strategies? Well, we look to experts in the field, Institute of Medicine, you can see the list here, National Highway Traffic Safety Administration. These are some of the resources that are out there. And I want to point out, when it comes to alcohol in particular, we are challenged with resources like this as it relates to finding evidence-based strategies. If you worked on tobacco, you'd have about 10 of each of these kinds of topics, Institute of Medicine reports and Surgeon General reports, CDC reports, and we're kind of challenged. We don't have as many resources when it comes to alcohol. So we are kind of pushing the envelope when we look at what evidence-based strategies do work and don't work. So we go to these sources. We look at the World Health Organization's review. It's great. It's got 15 of the most prominent scholars in it that talk about how strategies are effective and not effective. And it's worth having because it helps you when you're trying to figure out what you're going to do, not waste time doing something that doesn't work and dumping money into something that doesn't work, right? I mean, it's like working on your house or a car, that the repair is worth more than the car is. It's time to get a new one. Sometimes our strategies that we've been using don't work anymore. I mean, maybe they never worked, but our science tells us to do better, so we do. So what strategies do we select? So this will give you just a little context. So Texans Standing Tall works statewide. We are a coalition. We are also a nonprofit. And so we pick strategies, and we work both at a statewide level. We work with state agencies, so TABC and TxDOT and DSHS and Texas PTA and a lot of other organizations are all part of our coalitions, but so are a lot of local coalitions as well as local individuals. So any of you all can join Texans Standing Tall. And here are some of the strategies that we select, some of which are funded with TxDOT funding and some of which aren't. And there's more than what I'm going to highlight here. But all of these are evidence-based strategies that you all could see being applicable in your communities. So compliance checks. How many of you are familiar with compliance checks? All right, so they're not mandatory in Texas. And so and there's no funding for them. Enforcing underage drinking laws, money has disappeared at the federal level for states. And so there's really not a lot of money for compliance checks. But this is a great strategy for you to use with community coalitions who have youth, because youth can do way more stuff than just going to pizza parties or listening to people give presentations. They actually can be a part of the strategies. We have a youth leadership council that works with us in partnership and gives feedback and makes leadership decisions for our statewide coalition. And they are we have 15 of them, I think, right now. We just selected the new group, and they are from all over the state. And compliance checks is a piece which focuses on retailers and should be a part of a comprehensive plan, but they shouldn't be the only thing that people think about doing, because social access is where the majority of our young people get alcohol. They get it socially, and then they get in cars and drive places, right? They go to a party, and they drive home. So the current provision of minors law is a very strong law, but the challenge is that it's hard to enforce because you have to have a lot of evidence in order to have it hold up in court. And so we're working on a high visibility enforcement campaign that combines the provisions to minors laws with the social host component, which is focused on nuisance violations. Basically, you have an unruly party, and we will make sure that you get in trouble for having an unruly party, which if I get enough fines for having unruly parties, I will stop having unruly parties, especially if there's a media campaign associated to it. And so that's how we've started working on this as a high visibility piece. And we have a controlled party dispersal training that we do with law enforcement, because as the law enforcement that we work with say, we don't want the fastest cop catching the slowest young person, running to their cars or through fields as they try to get away from a party. So how many of you all have had experience breaking up underage drinking parties or unruly parties in your communities? I'm curious. Are they often noise violations that you're going to? That's what we find in the communities, is that they're complaining about noise violations. So we're looking at how we can crack down on a way to approach the problem in a way that, as I think somebody in the last panel said, we don't just want people to get in trouble, we want them to stop doing it. So if I can discourage them from doing it, they don't want the fine, then this is what we're after. Okay, so at the end of the day, the goals are to control people from fleeing the scene, getting in their car, driving away, actually people getting citations, and for the adults who are providing the alcohol to be held responsible. Okay, screening and brief intervention. This is a project that we do with college campuses, which is outside the judicial setting, but you can learn a lot about it. Nancy's in charge of that program, actually. It is also a recommended strategy. This is how we're focusing on it in this case, and in this scenario, using it as a preventative measure prior to an alcohol incident or injury or violation. That screening and brief intervention, especially in trauma room settings, is one of the leading ways in which to address drinking and driving violations. And on college campuses where young people get into trouble, or they also don't get into trouble, but they're going to these parties, we have a way in which they have a conversation where they score themselves on how their drinking behavior is, and then they have a conversation with somebody about that. And our data, not just pre and post tests, but our longitudinal data, and we've been doing this for a number of years, shows that this works. That they have a conversation and they alter their drinking behavior. They get in the car less, they have fewer drinks, so on and so forth. And then the last conversation I'll have with you is a strategy about alcohol excise taxes. And mainly I'm going to talk to you about it because no one ever talks about it. And it's the strategy that has the most evidence behind it in the sense of there's been the most research done on it. And I'm going to show you how it impacts impaired driving. And we hired an economist a few months back to do a research report specific to Texas and the cost of excise taxes and how much money we could raise and so forth if we were to alter excise taxes in Texas. So I know that I've said the word taxes a million times now, and that's really a no-no. But I will tell you that we've been going around the state having conversations with people about some of this data, and I've been shocked at how many folks have been like, oh my goodness, so I'm hoping this will happen to you too. So, it's a basic economic principle. If you increase the price of alcohol, it decreases the demand. It's much like gasoline or butter or anything else, only alcohol is not an ordinary commodity. You know, it's not like you can't overdrink milk and then suddenly get behind the car and be unable to drive, right? But we often treat alcohol like it's any other commodity, but it's a commodity that we consume and then we can cause injury to ourselves and to others. And so we shouldn't treat it with the same kind of laissez-faire attitude that we treat buying any other commodity. So we feel quite strongly about that. And so when we start thinking about it as an economic principle, the thing is that it's not indexed to inflation, so it can stay stagnant over time. And so the way that this strategy works is that when it increases, people drink less and you have fewer alcohol-related problems. And you saw in some of the other data earlier today, these are the folks who we really want to drink less. Young drinkers and heavy drinkers. And young drinkers are really always heavy drinkers, almost always. And these folks cause a large majority of our problem. In fact, they cause a disproportionate amount of our problem. So if we can get them to drink less, then we have less problems, right? Less impaired driving, less dropping out of school, less so on and so forth. So here's some pieces around how much do Texans pay per drink in excise taxes. So you can kind of see relative to beer, wine, distilled spirits and how much we pay compared to state and federal averages. Here we are with alcohol types. So rather than it being a tax, it's a user fee, if you will. If you don't drink it, just like they said in the previous panel, if you don't drink it, you don't pay it. So, poorly performing revenue stream. So if you look at the difference between the cost. 19 cents is what it was in 1984. It hasn't changed since 1984. This is what it would be if it had been indexed to inflation. So I don't know about you, but I don't know anything else. My dollar didn't go farther. My dollar goes less far than it did in 84, right? So here's it by gallon. So we talked a little bit about how we compare to other states. We're even lower than Louisiana. Was that possible? Right? Okay. So now look at this. Who cares? Everyone hates Texas. Well, nothing will ever happen in Texas. So I did want to point out that there was a public opinion poll, and there have been several, where the one thing that people say that they're willing to raise, if they had to raise something in order to fill financial gaps or to address budget shortfalls, are user fees, and in particular, alcohol and tobacco taxes. The interesting thing that I find is that when I'm in the field with tobacco users, they focus on talking about tobacco taxes all the time, but when we're in this kind of field, the alcohol field and the same prevention field, we don't talk about alcohol taxes, and so that's why we're compelled to do so. So in 1984, this is the last time it was raised. This is what was going on then. I don't know about you, but 20 cents sounds good for a stamp. Price of cigarettes shows that it does actually work. This is how much you would have to, if you currently collected 7 cents on every cigarette sold. That's what the state of Texas collects right now. This is how much we collect on a serving of beer. Okay? So let me show you some other numbers real quick, because I'm about out of time. This is how much we could generate per year. So do you remember that billion-dollar number we had before regarding costs and stuff? If we raised it a dime a drink, $770 million a year. We are always talking about budget problems. So what if we raise the tax a dime a drink and it's already 25% slated for education? That's the way the code is written. What if the rest of it went to treatment and prevention and to law enforcement and you have to deal with this problem? Y'all are nodding your heads now, right? Now this is sounding pretty good. I'm not kidding. Because look at how much you're paying. Because the truth is we're subsidizing people to drive drunk on our roads and to use alcohol in a variety of inappropriate ways. And frankly, you know, if you're a moderate or low-risk drinker, that's perfectly fine. But if you're the one costing the problems, you ought to have to pay the tax. And so this is the piece. Look at this. I know this is a hard-to-read chart, but we're soon going to have a paper out that the economists put out. Right now it's going through the final stages of review. But you can see here, this is some of the charts from it. So the deaths that were attributed, so look at this. If you had a 10-cent increase, traffic deaths go down by 112, homicides by 55. That was the associated costs that you were talking about, Chief. Look down here. I mean, suicide is related. Like, you can reduce suicide by raising taxes a dime a drink among college students. I mean, it sounds crazy, but it's true. All the while, we raise money for us to do our work. So, cigarette versus alcohol excise taxes, this is how much you'd have to collect right now. I don't know about you, but that'd take about, I don't know, how many buggies do you think it would take to get in 32 cases of beer versus 1 carton of cigarettes? That's a lot of alcohol you have to haul up to the counter to get the same return on investment, so to speak. And so the bottom line is, we believe that you should choose effective strategies. You should pick ones that are evidence-based. You should be trained and equipped in order to have the conversations that make collaboration work. And that when we do things, that we should think about things that get us a win-win. We think that this is one of them that does. We have a whole, and my job is to bring you the information. There's a whole group of other people who have formed their own little coalition that are working on this as a strategy and a work group that formed out of Texas Standing Tall. But the bottom line is prevention is something that we can all do together and well if we all learn to work together and well and in a strategic way. Thank you.